Hey guys, what is up? What's up? Thank you so much for being here for today's webinar, Understanding Hip Impingement. This is where you are going to learn all about why that nagging hip pain that you have keeps coming back, even when you feel like you have tried everything else. So if this sounds familiar to you, then I promise you, you are in the right place. You're somebody that maybe feels like you have tried everything. You've done the PT, you've done the stretches, you've tried resting, maybe you've even already tried surgery, and you feel like you've followed everything that everyone has told you, yet your pain still keeps coming back or it never went away. And this is going to address why that is happening. So you are in the right place. Maybe you're somebody who is not sure if surgery is just going to be the end goal for you. You feel like that's it. That's all that's left for me. That's the only option that's on the table. Maybe you've already had surgery and just wondering, why that hasn't really worked. But if that sounds like you are in the right place. And lastly, if you are still struggling with day-to-day limitations, just everyday life things, you can't squat down to pick something up, you can't get down on the floor to play with your kids, maybe sitting in the car and driving for long periods is killing your hip every single day. Again, you are in the right place. We are going to address all of these concerns, and I promise there is so much that you can do for this. You probably just haven't found the right pathway yet. And I want to reassure you guys that you are in the right place. And I'm so glad that you found yourself in my world. So let's talk a little bit more about what the real underlying issue is when you have this chronic hip pain from either impingement or labral tears. The reality is, more exercise is not what's going to solve your problem. And that very likely is why you haven't found relief yet. It's You have to make sure that you have a good strategy behind what you're doing. It's not just throwing more exercises, hoping that the next thing will stick, or hoping, gosh, I'm going to just get as strong as I possibly can and that it's going to solve everything. That's not going to solve anything. It really sometimes only reinforces the dysfunction and the problem. What we actually need to address is how you move and why it's happening. And if you can figure that part out, I promise you, it is going to change the course of everything else moving forward. It's not about what exercises you do that are going to make the difference. It's about how you do those exercises, and more importantly, understanding the strategy behind how to progress through getting rid of this issue and what's even happening in your own body. Because up to this point, nobody has probably even explained that to you. And that is what I'm here to do today, is explain this to you in a simple terms that make sense, and give you some actual takeaways that you can walk away from after this webinar and immediately start implementing to see some results. So again, so excited that you guys joined me today for this, because I know that the next 45, 50 minutes is going to be absolutely life-changing for you. I will, just to kind of a quick little rundown of what we're going to go over. We're going to talk about what hip impingement and labral tears really are and what it even means, again, in simple terms for your body. So we're going to start to try to figure that out today. And you're going to walk away with a better understanding of what is anatomically going on in your hip, in a very easy to understand, easy digestible way. We're also going to do a few quick movements to start to understand how you can move more efficiently without feeling that pinching or that pain. And lastly, I'm going to take you through the framework that I use with my own clients that you can start implementing with or without my guidance, so that you can start to make some changes, again, as quickly as today. So let me just give a quick little intro to myself. If you guys don't know who I am, first of all, thank you for being here. I'm so glad that you found your way here to me, however you found me, through social media or whatever, a friend or a referral. I absolutely appreciate that you're taking your time out of your day to spend with me for the next couple minutes here, a next hour or so. So my name is Jenna. I am a physical therapist, and I am located here in Northern Virginia. I own a small clinic called On Point Wellness and Rehab. And by trade, my specialty as a physical therapist is dance medicine. So I work with a lot of dancers and performing artists. And as you can imagine, with that population of people, there's a lot of hip injuries. So I started seeing all of these hip injuries. I've been a PT for the past 14 years now, I think. And I started seeing this common pattern, again, in my dancers at the time, of all these hip injuries and hip impingement issues that were happening, and very quickly was able to see that there was a pattern between how these patients were moving and symptoms that they were having that kind of were all connected together. Certainly everybody's situation was a little different, but I really started seeing these patterns emerge. And as I treated it more and more, I really just started diving into and being able to help these people when nobody else could. And from that, I really have now expanded. I don't treat just dancers anymore. I treat everybody, but my main focus is treating people who have hip issues, specifically impingement and labral tears. Again, maybe somebody that thinks they have to have surgery or has already had surgery. So that's kind of who I see these days. And it ranges everything from moms, I've got runners, I have swimmers, I've got dancers still. And then I have people who just are casual, like they go to the gym and work out and want to stay active and lift weights. But all of these people, they come to me because number one, there is something that is their impairments are affecting them so much that they can't do what it is that they love, whatever that is. It's affecting them to the point where now they can't enjoy life. The other reason people find me is because nobody else could help. And what I love about that and hate about it at the same time is that I know that I can help you. I know that I can help these people. I'm so confident that I can take you from being in this place where you're hopeless to finally seeing the light at the end of the tunnel and being able to make some real lasting changes in your hip when nobody else could, because I care and we take the time, and I have a trained eye to watch that hip move a little bit more than somebody else that you have seen probably does. So I do love that I get the people that have failed everything because I get to see the transformation that happens on the other side. So if that sounds like you and you feel like there's no hope left, stick around to the end, because I promise you, I'm going to show you how to dig yourself out of that hole. So let's talk a little bit about the core framework before we dive into the actual movements. And this framework is the framework that I use with every single patient that I work with, whether it is an in-person in my clinic, or I see a lot of patients virtually these days. The majority of my patients I see virtually these days. I walk them through this exact same framework. It's also the same framework that I talk about in my book or in my course. No matter how you encounter my information, no matter how you encounter my information, this framework is at the base of all of it. And it's going to be the same no matter what. So I take people through 4 phases in this rehab process. And the first phase, I call it the core framework. The first C is calm. The O is optimize movement. The R is rebuild strength. And then the E is elevate performance. So let's talk about a little bit about why I use this framework and how to progress through these phases. So the first important phase is learning how to calm and also understand what's happening in your body. When you understand what's happening in your body, it's a lot easier to calm your symptoms. So this phase is really all about trying to figure out, what are my triggers? What are the things that set me off? A lot of people feel like there's no pattern, a rhyme or reason to why their pain happens. And the one thing I can promise you is that there is a pattern. You just haven't found it yet. So you have to figure out that first. And from that, you're going to be able to figure out a couple exercises that help calm the symptoms immediately. Now, a little bit later on in this webinar, we are actually going to go through one of the things that I use to start to calm that system and calm your pain down. So stay tuned and I will explain a little bit more on this. The next phase is moving into optimizing movement. So this is the step that I think is most often skipped. It's learning how to move efficiently so that you can actually correct those patterns that are causing the stress on the joint. If you don't do this phase and you jump into the next one, which is rebuilding strength, you end up reinforcing the dysfunctional movement, not the movement that we want. So it is crucial that as that pain is starting to calm down, you are optimizing movement and relearning the correct patterns to take the stress off the joint. And then in this third phase, we get to layer strength on top of that. Now we're going to make sure that you are efficiently strengthening the patterns that we want and that are actually going to help your hip and not make things worse or make them stay stuck where you've been stuck. And then the last phase, because getting out of pain is not the end goal, and neither is building strength, it is being able to really elevate to the level of performance that you're looking for and make sure that you're getting long-term lasting changes. There's always some level of maintenance that you're going to have to do. All that work that you put in to get rid of the hip pain and to correct the impingement or the labral tear, you're going to have to keep working at it to make sure that it stays that way. And that may evolve and look very different over the course of time. It may end up being that you are just doing a regular exercise at the gym with a couple hip specific things in it, but you are doing something that is going to prevent these problems from coming back. And it really does take learning this process and ingraining it into your lifestyle to make sure that, down the road, 3 months from now, maybe you're not feeling pain anymore. But if you start to feel a little twinge of something, you know exactly what to do. You've learned the tools that you need to carry you forward. And this framework is what allows you to do that, whether or not you have my guidance or a PT's guidance or whatever. You're actually going to learn it for yourself so that you are in control of your pain and don't have to rely on all the PT visits and all the extra time and money spent, but that you are in control. It takes a little bit of learning to get there, but once you do, again, total game changer. All right. So let's dive into the fun part. Let's do a quick little anatomy lesson. This is probably the part you guys have been waiting for to figure out what the heck is happening in my hips. So we're going to talk a little bit about the structure and what labral tears even are. So your labrum or your hip is a ball and socket joint. And you know what? I am going to, let's stop this screen share. Whoop, I hit the wrong button. Sorry, guys. Okay, so let's stop this screen share and I just want to talk to you for a second. So what we're going to go through is the anatomy here. I've got my little pelvis, so I figured this will be easier to see. So we have the ball and the socket joint, okay? The head of the femur, which is the leg bone, that's the ball. And then the socket is on the pelvis, and that's called your acetabulum. So oftentimes you will hear the terms femoroacetabular impingement or FAI syndrome. That is what it is referring to, femoroacetabular impingement. So head of the femur in the socket on the pelvis. Now, ideally, when we move, the head of the femur is going to stay in the center of that socket. So there is a little bit of movement and gliding at the joint level that you really can't feel from the outside, but it's got to happen on the inside so that everything stays centered and we don't get too much compression. So what happens if it doesn't stay centered? And again, a lot of this is coming from movement and muscle control. But if this doesn't stay centered, when we go to flex our hip, for instance, the head of that femur glides a little bit too far forward, and we end up getting compression between the femur and the acetabulum. And that's the FAI impingement that you feel. And here's where that creates a problem. On the inside of this socket, this is where your labrum is housed. Your labrum is a ring of cartilage that sits right on the inside of that socket that helps cushion that joint. And it also helps make sure everything mechanically works. But the problem is on the front side of this joint, that labrum is really thin and sort of exposed. And if we don't use good movement mechanics within the joint, and we do get too much of that femoral head glide forward, what ends up happening is it compresses not only where the bony part is, but it hits the labrum. And over and over and over again, that repetitive compression is what creates the labral fraying or even possibly a labral tear. And so it's really important that we learn, again, how the heck do we correct these movement patterns so that you're actually able to make this head of the femur stay in the center and take the pressure off of the labrum and the socket. And that really is going to be the key in long-term change. That's also why a lot of these other quick fixes just don't work. The other really important thing to mention here is this is often the movement piece of impingement is often not picked up on an image. So we have two different types of impingement. We have a structural impingement and we have a functional impingement. Now, a structural impingement is what it sounds like. It's when the structure of the hip allows that impingement to maybe happen a little earlier in the motion or in a range where we don't want it to happen. And that can look like a few things. So many of you may have had imaging and maybe have seen this diagnosis before, but you may have heard of cam or pincer impingements. And basically what that means is there's either too much bony growth on the head of the femur, there's too much bony growth on the acetabulum, or you can get a combination of a little bit of both. So if there's extra bone laid down there and I try to move again, and maybe I don't have good patterns on top of it, I'm going to get too much compression and I'm more likely to get the impingement pain and maybe a labral tear as well. Now, there's also a functional impingement. And this, I think, is the most important thing to know because a lot of times we only think of impingement as structural. We see it on an image, there's a problem there, we got to go in surgically, we got to correct it. Well, the reality is a lot of people have a structural impingement. In fact, they have done numerous studies where they'll look at asymptomatic hips. So, meaning people have no symptoms, no pain, no anything, no pinching, no catching. And 60 to 70% of those hips will show a structural impingement in an asymptomatic hip. That means we know that that's how common these structural changes are, but they do not automatically equate to more pain. And that is so important for you guys to understand, especially if you've had an image, because your image is not, it's not the story. It's one piece of the puzzle. It is not the whole picture. And it sometimes gets in our heads that, oh, there's nothing I can do about this. I have to have surgery to get that removed. It's not true. I have many clients who do have a structural abnormality and are able to get through this with conservative care because there is such a big functional piece. The MRI, the X-ray, they don't look at function. They don't look at how you're moving. They don't look at how the muscles are coordinating to make sure that this hip socket stays centered and it's not getting that compression. That's the piece that we can change with or without the structure. Now, sometimes you get so far into it and we're like, okay, it's not making a difference. And then that's a different story. But what I can tell you with certainty is try conservative care first with a therapist who actually understands how to move this joint and what happens with impingement and labral tears, because any old therapy probably is not going to be what you need. You need specialized care for learning how to correct this. And I promise you, if you do that, you're going to be amazed at how many changes you can actually see take place. The other thing that I just want to kind of throw in here and mention is what happens when we have things like, and I'm going to actually go ahead and reshare my screen here too. What happens when we have things like hip dysplasia, hypermobility? How does that play into all of this? This is important to know because a lot of you guys may be struggling with these things. So hip dysplasia is extremely common as well. And it's really common to have a labral tear or impingement alongside dysplasia. So what dysplasia means is that socket is a little bit more shallow. So there's not as much stability there naturally. And now my hip joint is going to rely a lot more on muscular control to keep everything stable. But sometimes with dysplasia, because we don't have that good stability, all those muscles around the joint just want to like contract and stabilize and do this kind of their job to like make sure everything stays stable. And so you end up feeling like you have less mobility. And this is actually the exact same thing happens when we have hypermobility in the joint. Not a lot of stability, a lot of extra movement and joint laxity. And so all the muscles around the joint stabilize. They contract, they pull in, and they say, we're going to make this stable. And so what you're left feeling is, I'm so tight. I have this extreme tension that nothing that I do makes it go away. But really, it's just your body creating a false sense of stability. And it's hiding, very likely, an underlying problem with stability and strength. And so we have to make sure that we go after this underlying stability problem and the strength problem and the movement coordination problem so that all those muscles that are like working overtime to keep you stable can actually start to relax and be used when they need to be used versus constantly all the time. And that is what is going to get you out of that feeling of I have to stretch all the time or I stretch and absolutely nothing changes it. We have to go at the root cause, which again, hip dysplasia and hypermobility are two of the big reasons that we're going to see impingement and labral tears. And there is a chance that you might be struggling with one of these things as well. So I do think it's really important to just take note of that. The biggest takeaway that I want you to have from this brief little anatomy lesson is that your diagnosis of a tear or a structural problem doesn't mean that there is something wrong with you. It's extremely common to see these things. It just means that your joint maybe isn't being loaded properly, and there are things that we can do to correct that. And again, that's what we are going to talk about. Let's just jump into kind of the three biggest reasons why nothing has probably worked for you so far. These are some of like the biggest myths that I see surrounding impingement and labral tears, and kind of the things that I constantly am talking to people about in DMs and that they're asking me in their sessions and whatever. So there are three common things that I see are why people have failed everything else, like physical therapy or even straight surgery sometimes. The first is they're only focusing on glute strength. Now, when you say that you've got impingement or a labral tear, you're going to go in, you're going to see that physical therapist, and chances are they're going to load you up with a million glute strength exercises, clamshells, band walks, deadlifts, maybe some squats. Like you are just going to be loaded with glute exercises. Is glute strengthening important? Yes, absolutely. But what is more important than glute strengthening is following that framework, learning how to calm your symptoms, relearning how to move efficiently. Then we add the glute strength on top of it. We can't just jump straight ahead to glute strength. We have to take the time to learn, how do I actually fire my glutes? And what I can tell you from a lot of years of experience doing this is that most of my hip impingement people have no idea how to actually find those deep hip stabilizers and use their glutes efficiently, not gripping, but truly use them for stability. So chances are, if that sounds like you, if you're somebody that's been doing all the glute strength and nothing has changed, chances are you're not doing them correctly. And we need to just back up to some of those earlier phases before we go back to it. Another big reason, you're trying to stretch the problem away. I also call this, you're like chasing the quick fixes. The reality is there is no quick fix for impingement. There are things that we can do in the short term to make you feel better. Maybe it is some dynamic stretching. Maybe it is some breathing, like we're going to talk about in a second. Maybe it's some foam rolling or some massage or some manual therapy. Absolutely, those things have a place in the early stages when you're in a lot of pain. But the reality is, those things aren't going to make lasting changes. A quick fix is for a short term change. The way that we're going to make long-term changes is looking for long-term solutions. And that is not trying to just stretch. Stretching alone is not going to solve the impingement. What's going to solve the impingement is number three, kind of leads into number three, learning how to move. And so this is the third biggest mistake is people do not take the time to learn how to move to put less stress on the joint. They jump into the stretching, they jump into the strengthening. They're doing high level exercises, maybe because their PT feels like they're strong. I see this in my dancers a lot. They're like, oh, you can stand on a Bosu and do all these things, and oh, it's amazing. Let's just do them. But it doesn't mean that they're recruiting the right muscles and moving in an efficient pattern. And this is without a doubt the number one reason. I know I put it at three, but these are not in order of importance. I would say this is the number one reason why people fail their physical therapy. Nobody has shown them how to move with less stress on the joint. That is what we're going to talk about next. And again, just I want to make sure we really drive home that there is no perfect exercise. There's no one magic exercise. It's how you do the exercises that are gonna make the difference. There's actually a lot of good exercises out there. You just got to find the ones that work for you, but also make sure that you're following this framework. So let's dive in a little bit to a couple steps within this framework. We're going to talk briefly about step one and step two. Step one being calm the system. So this is without a doubt the number one thing that I start with the majority of my clients who come in to work with me. And the reality is our nervous system is what sort of holds the key to making long-term changes. Most of the time, especially if you've had pain for a long period of time, your nervous system is on high alert. It's constantly gripping and guarding and protecting because it doesn't want you to move into ranges that are going to create pain. Your body remembers pain. It doesn't want to feel pain. So our brain and our nervous system trick us into ways to not feeling that. And one of those is being sort of braced up and guarded and ready. We need to break through that because no matter what exercises or movement or anything that you try to implement, those later phases, if your nervous system is still on high alert, all of those things are still going to create pain, or they may just not make things any better. They're going to keep you stuck. So what I often will give to people as step one, and what I would encourage you to walk away from today with, is breathing. So learning how to really and efficiently diaphragmatic breathe. And I have a few videos on how to actually do the breathing and making sure that we're finding length in the pelvic floor and all of that. I will send those to you guys a little bit later, just for the sake of this. I'm not going to go through in depth there because I have some other videos I can direct you to. But I do want you to make sure that you understand that just diaphragmatic breathing as a whole is going to be, for most people, the best starting point, the best first exercise for you. It's teaching your nervous system to finally calm down and chill out and, oh, hey, this is safe. You can do this. But it is really important that you learn how to lengthen through the pelvic floor and the hip muscles, because I'm bring my little pelvis back up here. Our pelvic floor is this sling of muscles that sits on the inside of the pelvis here. And the pelvic floor is part of your hip joint. The pelvic floor is also the base of your core. So when we diaphragmatic breathe, we have to make sure that we're actually getting some length through this pelvic floor and hip. Otherwise, we're breathing all up high, not actually making a change in the hip itself. Now, there is definitely still some benefit to like down training and regulating the nervous system. But if we're going to really do this and do this efficiently, we want to make sure that you're getting that length through the pelvic floor muscles. And so again, I'll direct you to some other videos to actually walk you through how to do that, just for the sake of time for right now. But that is going to be huge. Keep in mind that this takes time. We're trying to build trust in our system, and that's not a quick thing. We have to make sure that your hip and your body feels safe again. And it feels safe by small, consistent changes over time, meaning repetition with this, doing it not just once and throwing it away and saying, oh, that didn't work, but doing it consistently over the course of weeks, days, months, so that your body slowly is building trust again. And some of those walls and barriers break down and you actually are able to move with freedom again. It's also really going to help your body. It just helps your body learn that it doesn't have to be afraid of certain movements. Sometimes I talk about it's like putting a coin in the confidence jar. That, oh, maybe lifting my hip used to really bother me, and I can actually do it pretty safe now, but my body still thinks it's going to hurt, so it guards and tenses up. But every time I show my body, oh no, wait, you actually can lift it, and that didn't hurt. It's like depositing a coin in that piggy bank. And over time, you keep depositing those coins, and slowly that trust bank builds and builds and builds. And now your body no longer is flinching and guarding every single time you bend over to put your shoes on. So it takes time, but it is worth putting the energy into early on in the process. This is where people often get stuck in this flare up loop where they are super flared up. So they rest, they do nothing. And then they start to move again and they go right back into a flare up. And it's because they haven't done anything to change the nervous system or how they're moving. And the body just keeps learning to guard and protect. And the longer that it does that, the harder it is to trust movement again, and the harder it is to break free from that. So it's crucial that you learn to do this early on in the process. And I don't say that to discourage you if it has been a while and you haven't been doing this. You can still correct it. You can still make changes. Just know it's going to take some time. So to not be frustrated by that. But number one, calming that system, learning how to breathe, that's where you guys can start. As you figure out a few movements in that phase, so phase one is really also about trying to pick one or two, maybe three things that consistently make you feel better. Everyone's going to be slightly different of what those things are. But once you start to figure out, okay, these things make me feel better, it's starting to calm my symptoms, I can do a little bit more on a day-to-day basis, we want to move into step two, which is actually starting to retrain movement. Now, I'm going to go ahead and show you guys one of my favorite things for this, which is a rock back. If you've been following me for a while, you have probably seen me do this. It truly is one of my favorite ways to start people off, or at least after they do some breathing, because it really does change how that hip understands movement. So I'm going to go ahead and stop my screen once more here because I want you guys to be able to see me. So for this movement, you're going to go onto your hands and knees. Tuck this in so you can see. You're going to go onto your hands and knees. Now, if you remember way back in the beginning of this webinar, I talked about how when we move, ideally, the head of our femur is going to stay in the center of our socket. So as I flex my hip, it should stay centered. Most of the time that's not happening if you're struggling with impingement or labral tear. So we need to teach it to. And the reason it doesn't happen is because of all this, like just not knowing how to coordinate and whatnot. So this is a muscle retraining exercise or a movement retraining thing, not a strength exercise. And so what you're going to do is on hands and knees, you're going to start with a nice relaxed neutral pelvis. And the movement itself is just going to be rocking your butt towards your heels here. That's all the movement is. But there's a few very key things that we want to think about. So the first one is neutral spine. You'll notice when I rock back, I am not arching or tucking my butt. What that's going to allow me to do is keep the head of my femur centered back into the socket. If I'm tucked under, here's the head of my femur. If I tuck under, the head of my femur is going to push too far forward to the front of the socket, which is often the pinch that you feel. Most of the time, people with impingement and labral tears have more of the tendency towards the butt tuck. And that butt tuck, again, puts the pressure forward right into the front of the socket, which is often the catch or the pinch that you feel. Keep in mind, now a lot of my people will say, well, no, I have too much extent, like too much arching, or lordosis, as some people will call it, right? Too much arching this way. And usually what I actually see when they start to move is, yes, maybe they have that, but they've been told it so much that now they've overcorrected it. So their butt and their glutes are constantly gripped and tucked under to try to get that arch out of the back. And again, head of the femur presses forward. I get all the pain to the front. So it's really important to, again, learn how to release and relax. So when I do my rock back, that's exactly what I'm trying to create. I'm trying to find this relaxed position in my hips. I'm going to keep a neutral spine and imagine the head of my femur going back towards my heels into the socket. And that's it. We're just going to rock back and forth. Now, ideally, you shouldn't feel a pinch. If you feel pinching or you feel pain, you shouldn't keep pushing through that. You're only going to go as far into that range of motion as you can without feeling the symptoms. And this is a really great way to start to retrain hip flexion again. And again, this is an early on exercise. So first, we're just trying to calm everything down and relearn the movement patterns. You don't need to worry about a ton of strengthening here, especially if you're feeling a ton of pain. You just need to learn, how do I make that movement happen? And I understand how to make that movement happen without feeling the pitching or the catch. And then we can progress and layer in the bigger movements and the strength training. So for example, many people who have impingement cannot squat. It brings on pain, it brings on a catch, it brings on, problems. So they go down into their squat and immediately, oh, I got pain, I'm stuck, I can't go any further. And they think they can't get into it. But if that sounds like you, what I would encourage you to do is try this rock back. So when you go here, how far back can you go before you feel the pinch? Now, if you're somebody that's like, okay, I can get to here, well, guess what? The bottom of your rock back is the bottom of a squat. You're just turned on your side. So what this tells me is that if you can get into that position and it doesn't hurt like it does with a squat, it's not your structure. It's the way that you're moving to get there. And when we're standing, there's, there's gravity, there's making sure muscles are coordinating and doing what they're supposed to. So there's a lot more that goes into that. When you're on your hands and knees, it takes gravity out of the equation. The muscles don't have to support you and stabilize as much anymore. So your hip is actually free to move with the right pattern. Now, for some, they're going to be able to jump back into a squat and figure out how to make that happen. But for most, it's going to take some retraining and really understanding how to grasp that movement change before we can bring them back into a squat. And there's lots of progressions that we can take you through and that I take my clients through to get you back squatting with weight and with a barbell and all the bigger things that you want to be able to do. But at the very beginning, you just have to learn, how do I flex my hip so that it does not pinch anymore or so that it does not hurt? And that is why movement retraining is so important early on and not just jumping into all the bigger strength exercises. If you're somebody that's maybe a runner, this is also something that, I feel like I talk about it a lot with my runners because runners want to get back into running. They're like, that's my identity. That's who I am, but they can't squat. Well, you can't go to running unless you can squat. And you can't squat unless you can hip hinge in that hands and knee position, because running is a single leg mini squat over and over and over again with impact. So we have to make sure first, can you flex your hip? Then, can you squat? Now, can you single leg squat? Now, can you add impact? Now, can you add repetition? And that is the process we have to take somebody through. And that's not an extreme example, but it's a higher level example. But it's the exact same framework that we just talked about going through. How to move, layer in the strength, and then bring in the challenge and elevating performance after that. And I promise you guys, if you learn to follow that, you can apply it into any exercise that you do moving forward, not just this one magic exercise that's supposedly going to make everything better. Okay, so let me pull back up my screen for you. Sorry, I'm kind of going back and forth here. Few more things, we're almost through, but I want to talk about what comes next, because basically up to this point, we've talked about what is going on in the hip joint, kind of what hip impingement, what labral tears are. We've talked about kind of the phases and the framework that we're going to follow to get through that rehab process and make lasting changes. And then we started to give a few examples of what types of things would you do in that phase 1 and phase 2. So calming the system with some breathing and other things like that. And then we're starting to relearn movement through something like a rock back and squat progression. So how do you actually take this and turn it into something that works? Well, what I can tell you guys is when you have a strategy and you're not just doing the random exercises and doing all the things that, throwing everything at the wall and seeing what sticks, I can promise you that when you actually have a strategy behind it, it will be a game changer. And I can tell you this because I see it every single day. So let me tell you about some of my clients who have had absolutely amazing results. So my first one here, she had said that she could suddenly, now when I first started seeing her, she couldn't do any squats, nothing. And all of a sudden, after just a couple weeks, she was doing 2 sets of 20 squats every single day, no pain, which meant she felt stronger and could start getting up and down from the ground again. She's a teacher and she could finally move again and get up and down from the ground with the kids. So much so that she canceled her hip injection, guys. That is huge and such a real result because so many people jump to the quick fixes. And like she said here, it didn't really ever work that much anyways. It was just very temporary Band-Aid. And she was actually able to not need the injection just by learning how to implement these things, how to calm the system and retrain movement. I had another client who had said that they had seen every provider under the sun, nothing had changed. And also, they still didn't have an understanding of what was even happening in their body. And after we started working together and going through the programming, he actually understood what was happening in a way that nobody else was ever able to explain. The power of understanding your body and what's happening in your hips, guys, it is so empowering to be able to solve these problems for yourself and not have to rely on someone else. You need a guide to get you there, but long term, you can't go in to see the PT forever. I mean, I'm sure you could, but you probably don't want to. Your wallet doesn't want you to. Your time doesn't want you to. You need to be able to understand how to do these things for yourself. And just having somebody explain it to you and show you the framework of what to walk through means it is your knowledge forever and you can apply it into anything moving forward. And this client in particular, who had felt like he had a really big goal on his list. I actually don't have it here, but it was to walk the Camino de Santiago in Spain. And he just felt like that was never going to happen until he started doing this program and realized that it was absolutely going to be possible for him. The last one is, this is exactly why I do what I do. I will tell you guys this. So this patient had said that since September, they had been in physical therapy for a tear. And there was slight improvement, but nothing really standing out. There were still problems. Just 3 weeks into doing one of my programs, he had 0 pain. 3 weeks, guys, was all it took after months of struggling and trying everything that didn't work and thinking he had failed physical therapy and that PT wasn't going to do it. It really was because the therapist did not have a strategy behind what they were doing. As soon as we implemented this framework, he was able to bring his pain down to 0 and finally felt emotionally in a better place. Like, I don't have to go have surgery anymore and I am in control of this. These are real results, people. This is real. This works. It's just about making sure you have the right strategy. So what is this program that I'm talking about? It is the hip lab, and it is your next step to finally getting the answers that you're looking for and figuring out how to move your hip in a way that makes sense. So the hip lab is a 4-phase course that is going to walk you through how to implement the core framework exactly like we laid out today. Today was just a little tidbit of what is inside of there. But if you actually want somebody that will walk alongside you and teach you how to implement at each of these phases for your body, this is the program for you. And I can promise you guys, you're going to start seeing results from it, just like those other clients did. There are pacing guides and symptom tracking tools inside of it. There are things you can print out. There's cheat sheets. There's everything that you need inside of there, alongside video instruction and step-by-step guidance along the way through the program. It is an at your own pace program. So no more do you have to rely on those physical therapy visits or those copays or any of that. You get to do this at your own pace at the speed that your body needs. There is also a Telegram group, so you guys get to connect with each other and talk to one another and ask questions. And it's been a great space for all of these hip lab participants. We have some really good conversations in there, and that is included in the hip lab. And as a bonus, you guys get 2 free months access to the Hip Lab Society, which is where we have monthly group calls. And there's a workout program inside of an app that you can do once you've completed the hip lab work. So these live group calls, group coaching calls are with me. You get to come, you get to bring your questions. I will help you. I will help guide you through. You get to listen to other people's problems and the solutions given there. Because most of the time, what one person has a question about, so does everybody else. So it's the perfect opportunity for you guys to connect with me and actually get some real feedback and some real guidance. And if you join the Hip Lab, you get 2 months access to that for free. Right now, the Hip Lab Society, the only way that you can get in is by either doing the Hip Lab or one-to-one coaching with me. There is not the ability to go into this on its own, at least right now. So if you want those access to those monthly group calls for a much lower price than one-to-one coaching, this again is going to be the perfect program for you. The other thing that I do want to mention, I don't have it up on the screen here, but if you guys join within the next 24 hours, I am going to give you the free copy of my new book called Hip Impingement to Hope. So I'll mail you off a copy, unless free shipping as well, unless you're located outside of the United States, then there will be shipping. But anybody in the US, completely free, shipping included, all of that. You'll get a free copy of the book with your purchase of the Hip Lab. I can't wait to have that book in your hands too, because again, it is basically the companion guide for the Hip Lab. So it just enhances everything that you're going to get in sort of a manual that you can take with you and read. And it's a labor of love, and I'm so excited to get it into your hands. But this Hip Lab today, it is $299, is a one-time investment, and you have lifetime access to it. So if you are interested in finally solving the problem and finally figuring out what it is that your body needs and what's been missing from everything that you've tried and nothing has worked, this is the answer to it. And I know that you guys are in the right place, and I promise you that I can help you. If you have any questions about how to join this, or if it's the right fit for you, please do not ever hesitate to reach out to me, because I'm more than happy to have that conversation. I do want to make sure that it's a good fit for you. But if everything you've listened to in that webinar really struck a chord, then I promise this is going to be the right next step for you. So thank you guys so much for joining me today. I cannot wait to hopefully connect with you really soon in some of these monthly coaching calls. And as always, reach out if you have any questions, but take care.